The federal government has raised its travel advice for the Chinese provinces to Wuhan and Hubei to level 4, as the death toll rises to 41 and more than 1,200 people are infected by the coronavirus. Foreign Minister Marise Payne says Australians should not travel as they may not be able to leave until Chinese restrictions are lifted. Currently, 5 people are being tested in New South Wales for the virus, while 2 others in Queensland are waiting for the results. The disease has been rapidly spreading across the world, including Europe and the US. China has expanded an unprecedented lockdown to 13 cities and at least 36 million people to try to prevent its spread.
This is the front line of the epidemic in Wuhan, and it is bleak. We cannot verify the status of the people under the sheets. It is a crowded, chaotic and terrifying scene, one that shows what doctors, nurses and patients are enduring together. The footage is at odds with the efforts on the ground portrayed by state media. This is the extraordinary sight of a new 1,000-bed hospital being built from scratch in less than a week. The infrastructure propaganda that is a symbol of China's rise, repurposed for an epidemic. State media also focused on the bravery and hard work of medical staff in Wuhan, albeit in more sanitized conditions.
What worries us most is the inconvenience caused to local residents. Although we have taken some countermeasures to alleviate the situation, there are still many difficulties. We aim to use the temporary inconvenience in exchange for long-standing safety.
Wuhan itself has been cut off for more than 36 hours now. People are stocking up on supplies because they simply do not know how long they'll be on their own.
When they officially said, OK, close down the roads, close down all transport, that's when everybody started really getting serious about it, and we started to wear the masks in public and carry hand sanitizer with us.
In the neighbouring province, it was a very different picture.
We got out of Wuhan just before the travel ban came into effect. We drove about 3 hours north here to Xinyang. And it's noticeable that even though it's just over the border, people are a lot more relaxed. A lot of them are not wearing face masks. They are a bit nervous, but they're not panicked at all. You're not wearing a mask. Can I ask why?
I was busy just now and I forgot about the mask, but I should really wear it.
I'm paying attention to the situation. I feel the country is doing great.
But here, like many places in China, face masks were difficult to come by.
Now the masks are sold out 4 days already. Like this morning, just within about 1 hour, we had a dozen people coming in to ask if we have masks.
In Xianing, south of Wuhan, authorities turned toll booths into checkpoints. They measured people's body temperatures. Anyone with a high reading was sent to hospital. In the capital, Beijing, the televised celebrations for Lunar New Year are choreographed months in advance. This was an uncharacteristic last-minute addition, a tribute to doctors and a rallying cry for the country. It must have felt a world away in Wuhan.